Senator Williams.
Thank you, Mr Acting Deputy President. I'd like to continue on with my brief start I had for about 30 seconds on this legislation when I first spoke. This is a really good plan put forward by the member for Lyne, David Gillespie, a National Rural Health Commissioner, to actually look at the health issues in rural and regional areas and give frank assessments, frank opinions to the ministers. Mr Acting Deputy President, there are many things we could do within regional areas. One I've been promoting at the moment is for neurological nurses throughout not only New South Wales but Australia. People with Parkinson's disease, such as I have, so far so good, but also motor neurone disease, that terrible disease, and multiple sclerosis. We have just 3 of those nurses, such nurses in New South Wales, I believe, one at Nowra, one at Wagga Wagga and one at Coffs Harbour. And a motion passed at the New South Wales Nationals Conference at Broken Hill a couple of weeks ago, where my good colleague Senator Nash was there, to see that the federal government, along with the state governments, 50-50 fund these neurological nurses. That's one thing we need to discuss with this health commissioner when this commissioner is appointed. And I would hope that this legislation would be supported right around the chamber. Mr Acting Deputy President, another thing we're short of is, in many, especially remote areas, are dentists. Now, when early in this job, 8 years or so ago, we received an increase in our electoral allowance payments of some $4,800 a year. Since that very day, I've donated the $4,800 a year to a rural dental scholarship, actually managed by the National Rural Health Alliance, where a first-year dentistry student going to university receives my $4,800, $400 a month for the 12 months, a big assistance to anyone, but especially a university student who has to travel, get accommodation. On a verbal commitment, they come from a rural background, a regional background, and they will return to those areas to practice when they become fully qualified and professional dentists. So I've actually put a bit of money into that, and I'm very proud to say that we actually have our some $40,000 now I've paid out in that field as sponsoring my dental scholarship. Mr Acting Deputy President, there are many things we need in regional Australia as far as health goes. So what will be the role of this health commissioner? How will it work? The commissioner will work across all levels of government to improve rural health policies and champion the cause of rural practice. The first task of the commissioner will develop a national rural generalist pathway. They will work with the health sector and training providers to define what is to be a rural generalist. The Commissioner will develop options for increased access to training and appropriate remuneration for rural generalists, recognising their extra skills. Working with the sector and training providers to define what is to be a rural generalist, the Commissioner will develop options for increased access to training and appropriate remuneration for rural generalists, recognising their extra skills. While the Commissioner's first priority is the development of the pathway, the role will be much broader and will include consultation with stakeholders to also give consideration to the nursing, dental health, Indigenous health, mental health, midwifery and allied health needs in rural and remote Australia. Dentistry is mentioned there again, Mr Acting Deputy President. For the Whip's benefit, I will not be speaking my full term of the 20 minutes here, so I might put you on notice who the next speaker is. Thank you for the thumbs up, Senator Urquhart. But what we've been told, and I have no reason to doubt this, is this National Rural Health Commissioner will be very frank in his or her assessment, whoever's appointed the job, to actually look at the details, assess the problems, come up with solutions and give frank opinions and directions to our health ministers, regardless of who is in government. I would hope that this is supported right around the chamber, that this National Rural Health Commissioner will be there for decades to come, because we've talked earlier on a debate about housing prices and foreign investors. Look, there's plenty of room out in regional Australia for people to move. There are plenty of jobs. We've actually got so many. Mr Acting Deputy President, you'll be familiar with that huge argument we had about backpackers tax and what to charge them, because we need them out there to work in our abattoirs and to work to pick our fruit when the seasonal work. We've got more than 700,000 Australians unemployed. Why aren't they going out to pick the fruit or work in abattoirs? That always amazes me. Perhaps we're a bit soft, Mr Acting Deputy President. We've actually paid people not to work. When I was a young fella, we didn't have enough land to support my father, my brother and me, so I learnt to drive a truck and learnt to shear sheep. Was never unemployed as a result. Not the easiest job going, shearing sheep, but I was young and fit in those days, a bit different to now, but age does weary us. And so this is a situation where we want people out in regional Australia. We've already seen the government working actively in that direction, with APVMA and many other government institutions being moved out the regions, freeing up the housing in the cities. And we have the land, we have the housing, the population actually grows jobs. The more population in a town, the more teachers needed, the more nurses, the more doctors, the more police, the more everything. So population in itself builds jobs. And if you don't believe me, ask what Canberra had 100 years ago. Probably some cattle, some sheep, beef cattle, dairy cattle, a few farmers, probably a little village somewhere, a general store. Look at it now. This is a classic example of regional development. And of course, the National Regional Health Commissioner will play a major role as the regional areas do grow, and I'm sure they will in time. People will be forced out of the cities because they simply can't afford to buy a house. Where I live in Inverell, lovely town, ample water supply, no water restrictions, never water restrictions. Even in the biggest drought, we don't have water restrictions. Thankfully, because of the Copeton Dam water supply, then you can buy a good home for $300,000. When I say a good home, 3-bedroom, brick veneer, on 800 square metre block, in a nice area of town, quiet area. That is not a lot of money. Wouldn't buy your dog kennel in Sydney $300,000. And so, as we grow the regions, this National Rural Health Commissioner is going to be vital to do a frank assessment of the things we need in regional areas as far as health goes. Sure, we're lucky in this country. If you're in a spot of bother and you're in a serious spot of bother, we actually have the helicopters, the air ambulance, those things with the emergency. But there's more than that needed. There's the aged care facilities, there's a general hospital and people just recovering from minor, even in some cases major surgery. So the dentists, of course, a shortage of them. As I said, the neurological nurses, I'll be keen to see those established right throughout Australia to take a bit of load off the GPs. But also, to get into a neurologist takes a long time. Often 6 months, you've got to book ahead to get in to see one. Most of them seem to be based in the cities. Well, the nurses could do a lot of good work out there in the regional areas, and I'm sure I look forward to the support right around the chamber of this, and I would hope no one is opposing this legislation. Support around the chamber, and I look forward to the appointment of the National Health Commissioner, and I look forward to meeting that Commissioner to have a frank discussion to say, look, here's a few things I can bring to your attention straight away. I do hope this is support around the chamber. It's all right to have everything, the cities and the specialists and the big hospitals and the good care we see in so many cases. In the regional areas, sometimes we are behind, simply because population can't. I mean, you're not going to book in Inverell Hospital for a heart transplant. You're going to go to St Vincent's. As simple as that. We simply don't have the big enough casualties, customers, clients, patients, whatever you want to call them. So I do think this is going to be a very good thing. I hope it's support all round, and I look forward to meeting the Commissioner ASAP when a Commissioner is appointed. Thank you.